these are what we are looking for. You know, you are having this issue, this disease for how many years?
Between 8 and 10.
Okay, so this is the base of your bladder. These are, you know, we saw them also in ultrasonography, but to be confident 100%. Also this part, which is reddish, look at this part. This is a normal bladder wall. It must be like this. This red part is also inflamed, and this white part is the source of everything. These leukoplakias.
Which part of the bladder is this?
This is, look, this is urethra.
And where is my pain?
Yeah.
More of the time.
Yeah, so it's very close to urethra.
Because
usually urethra stays closed normally, so it is very difficult for urethra to have a chronic disease. But it may have, of course, because it is contaminated very frequently from this part. So this contamination makes the urethra impossible to heal. First, this part must heal. After this part heals, urethra will heal by medications. I can't mechanically clean the urethra. I can't make fulguration in the urethra.
You can't.
I can't, because urethra, if we make some fulguration in the urethral mucosa, it will stick into each other.
I understand.
But it is staying closed, so it will heal by itself. Let me look at this part. I saw some little polyps. Do you have pain? How is cystoscopy? Is it tolerable?
Yes, it is.
So you came from another country, so everybody has some concerns about the cystoscopy. You also had, right?
Yes.
So is it as easier, or how do you think?
I can say it's absolutely normal procedure, and I don't feel any pain almost.
Okay. Did you have any cystoscopy before?
No, this is my first cystoscopy.
Okay. So look, this part of the bladder is completely normal, white tissue, and the entrance was, the problem was here. But when I look to bladder, look this red area. This part is the part when bladder closes. I am sure this will come into contact with your trigone, with the entrance part. So the problem in the trigone is disseminated to another wall of the bladder by time. So it will disseminate to all bladder. These all white areas will become reddish by time. And at that time, the problem will be irreversible. And it will be called interstitial cystitis. So I'm sure most of the interstitial cystitis cases begins with an infective cystitis. The infective cystitis becomes chronic cystitis, then it becomes interstitial cystitis. I can't say for everyone, but I am sure in some of the patients this is a scenario, because this part, when I look upwards, there are some reddish parts. Look at this. Okay, I will look an upside down position. Yeah, okay, this is our instrument. And the red part, this red part is the inflamed part.
The red part?
Yes. So we see kind of redness in every case, a little different than others, but this is too much reddish.
Yes, I see that.
And let's see the leukoplakia. The leukoplakia is the white plaques.
I see
this
that.
Is, yeah, around there, the white plaques. And all around the floating particles are infective tissues, or the shedding tissues. Sometimes, in some cases, this is more extreme. In your case, I can't say it is too much extreme, but still.
But the process is started.
Yes. Well, we can see the leukoplakia there. Okay, so there is no cancer, nothing, no problem. But the problem in your case, I usually stage the patients. Like stage 1 is when the problem is only in trigone. I call it stage 1. But in your case, the problem also moved to that part. Look, this is the trigone. here there's a red area.
You mean I'm in next stage?
Yes, so you are in stage 2. So I recommend you really try to solve this problem
Do you
as soon
think
as
that
possible.
fulguration
Will help you.
will help me?
Yeah.
And what else I can do?
Other than fulguration, I have no. My expertise is fulguration. I am not expertized in using medications to treat this, using some supplements, such things. I do fulguration first, then treat with other things. And overall, our success rate in Turkey, it is 80%. Last year, I operated many cases, like 100 cases from abroad, and they were the most difficult cases I have ever seen. And in these ladies, the success was 60%. It is strange. Why it is lower than Turkish cases? Because in Turkey, people use antibiotics when they have problem, when they have attack. They use 2 boxes of antibiotics and stop. But in United States and United Kingdom, they use it continuously. So I think it is giving some kind of harm to
Microbiome.
bladder wall, microbiome, urobiome we call it. Urobiome. And because there are some bacteria inside the bladder which must be there. And when you use a lot of antibiotics, you kill them. And in these ladies, I see the bladders are bleeding continuously from every part. And there are some exceptions, of course. Some of them healed nicely. But I can say the most important difference of the non-responders were using too much antibiotics. So I recommend everyone to solve the problem without using too much antibiotics and as soon as possible. Yeah, okay. So we can talk more. I am stopping now. I don't want to